The World Health Organization says the spread of monkeypox is a public health emergency of international concern. That's a major shift from the organization's stance just 1 month ago when the panel held back from giving the virus that designation. The general director says the WHO was unable to come to a consensus this weekend, forcing him to make the decision by himself. This is what he had to say.
We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
This all comes as the Biden administration considers whether it will also declare a public health emergency here in the U.S. and after 2 cases of monkeypox have been reported in children by the CDC. Officials believe those cases were spread within households, but they're continuing to investigate that. Let's bring in NBC News medical contributor Dr. Kavita Patel for more on all of this. Dr. Patel, great to see you on a Monday morning. I think so many of us are wondering, how concerned should we be about monkeypox? It sort of feels like, what else is going to hit us? And also, who's vulnerable? And help us understand how it spreads.
Yeah, Kate, of course it feels like what else can happen to us on the heels of COVID and so many other things. Number one, I think we just need to have our awareness heightened. That's really critical. It's something that we can contain, control, especially if people seek out testing, vaccination if appropriate. Getting to your point now, what to look for. What we're seeing is really interesting. The more common clinical syndrome that's been seen across the world previously has been a fever, some lymph node swelling kind of in your groin or in the neck area or armpits. Having that flu-like feeling sounds very familiar, right? Then followed by a rash. There are many cases that are being reported and some that I've seen where we're seeing the rash first. Very painful rash. Can happen literally anywhere in the body, but more common areas are in the oral area around the mouth or in the extremities, the arms and hands. So if you have a rash that's just unusual, Kate, period, or if you've been in an area where you know that there's been somebody with monkeypox or heard about somebody with monkeypox, get tested. We now have testing that's widely accessible. Takes several days to get back, but it's something that we should keep on vigilance. In terms of high-risk groups, we have been really talking about groups that have had travel to areas, but that no longer is relevant, Kate. This is really everywhere. We're seeing community spread. So talk about high-risk behaviors. We talk about this certainly with gay, bisexual, and transgendered individuals who have had multiple sexual contacts. But I want to expand this. Again, thinking very broadly, this is a disease that is easy to spread, and it's something that happens with prolonged contact. So unusual rashes, unusual symptoms. Just present yourself to a healthcare professional. We can test you.
And not to get too graphic here, but over the weekend you helped me understand that it's really about the rash or the body fluids, I guess, that are coming out of that rash, right? It's contact with that's the main reason it's spreading?
Yeah, this is really a prolonged contact. So let me just distinguish this from, for example, COVID or some other diseases that we've become, infections that we've become familiar with. It's not something from casually walking by somebody or even just casually touching a doorknob. This is something of prolonged contact. Think anywhere from hugging, kissing a household member, sharing common household items like toothbrushes or bedding or clothing. And then, again, sexual activity or just any contact, but it has to be with something that has usually a rash and usually some of that secretion, that kind of fluid that comes off of a rash.
Okay. The White House has been criticized for not moving quickly enough on this virus. Here's what the coronavirus response coordinator, Dr. Ashish Jha, had to say about the response.
I do think monkeypox can be contained, absolutely. The way we contain monkeypox is we have a very simple, straightforward strategy on this, right, which is make testing widely available. We have done that, and now testing is far more frequent and common.
It was slow.
Get vaccines out. Yeah, but we have right now the capacity to do 90,000 tests a week. I'm sorry, 80,000 tests a week. That's an extraordinary number. We're going to be releasing hundreds of thousands of more vaccines in the next days and weeks. So there is a very substantial ramping up of response that is happening right now.
Dr. Patel, is that all enough?
No, it's not enough. And certainly, I would say two key actions the administration could take today, and the World Health Organization declaring a public health emergency will certainly help. Number one, we should be looking for other ways to consider surveillance. We did this with wastewater and COVID. We need something analogous to that. And then number two, we need to be pushing common sense information, things that you and I are discussing right now, Kate. We need to be pushing this to all Americans, including America's clinicians, because many of us are not aware of when and whom and how to look for this, and to think much broader. Don't just look in particular cities and areas. We should be looking for this everywhere and in very different forms than what might be studied in a textbook.
And just quickly, we've heard so much about this being spread by men having sex with men. And for some, that response, this whole response is sort of reminiscent of the AIDS pandemic in the 80s. Is there a comparison there?
There's a comparison in which we have unfortunately discriminated and might even limit access to testing, treatment, vaccines, and life-saving therapies. And I think that's absolutely on point, Kate. I think I lived through that, from calling it gay-related infectious disease to HIV to AIDS, and I do not want to see that carnage over again. Good news here is that the majority of cases are self-limited. That is good news now. We can contain it, and we can do it today.
Dr. Kavita Patel, always great to have you with us. Thanks so much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.